What if a virus could not infect humans on its own and needed another virus to survive, spread, and cause disease? Hepatitis D virus, commonly known as HDV, is one of the most unusual viruses known to infect humans. Unlike most viruses, HDV cannot complete its life cycle independently. Instead, it requires the presence of hepatitis B virus, or HBV, to infect cells and produce new viral particles. For this reason, HDV is often referred to as a defective virus. The virus depends on the hepatitis B surface antigen, known as HBsAg, which forms the outer envelope necessary for HDV to enter liver cells and spread throughout the body. As a result, HDV infection can occur only in individuals who are also infected with hepatitis B virus. Transmission occurs through exposure to infected blood, sharing contaminated needles, sexual contact, and, less commonly, from mother to child during childbirth. These transmission routes are essentially the same as those of hepatitis B because HDV relies on HBV for its survival. After entering the bloodstream, the virus targets hepatocytes, the specialized cells that make up most of the liver. The liver is the primary organ affected by HDV infection. There are two major patterns of infection. The first is known as co-infection, in which a person becomes infected with HBV and HDV simultaneously. The second is called superinfection, which occurs when a person already living with chronic hepatitis B later acquires HDV. Superinfection is generally associated with more severe disease and a higher risk of chronic liver damage. Symptoms of acute infection may include fatigue, fever, loss of appetite, nausea, abdominal pain, dark urine, and jaundice, a yellow discoloration of the skin and eyes. However, some individuals may initially experience few or no symptoms. The major clinical significance of HDV lies in its ability to accelerate liver injury. Compared with patients infected with HBV alone, individuals infected with both HBV and HDV have a substantially higher risk of developing cirrhosis and liver failure, and hepatocellular carcinoma. In fact, HDV infection is considered one of the most severe forms of chronic viral hepatitis. From a virological perspective, HDV is remarkable because it possesses one of the smallest genomes among known human pathogens. Its tiny RNA genome relies heavily on host cellular machinery and the presence of HBV to replicate successfully. This unique biology has made HDV an important subject of research in viral evolution and molecular virology. HDV infection may be acute or chronic. Chronic infection is particularly common in cases of superinfection and is associated with progressive liver disease. Treatment has historically been difficult. Interferon-based therapies have shown limited success in some patients. More recently, the antiviral drug bulevirtide has been approved in several regions and represents an important advance in patient care. Nevertheless, treatment remains challenging, and ongoing research continues to explore new therapeutic options. One of the most important public health facts about HDV is that it can be prevented through vaccination against hepatitis B. Because HDV cannot establish infection without HBV, preventing hepatitis B infection effectively prevents hepatitis D infection as well. As a result, widespread hepatitis B vaccination programs have significantly reduced the burden of HDV in many parts of the world. Hepatitis D virus is one of the most unique pathogens in virology. Its dependence on hepatitis B demonstrates how interactions between viruses can dramatically influence disease severity, while also showing how a single vaccine can provide protection against two distinct viral threats.